What I love about being a nurse is making a difference in people's lives. Being able to go into somebody's home because they're not able to get out to the doctor's office makes a big difference to them. By allowing us to come into their home, they are so much more comfortable and they open up a little bit more to us. I met Nancy when she was 105. And at that time, she was having more and more difficulty walking. When I walk in, to see Mrs. Manno, it's usually, good morning, how are you today? And it's a bright-eyed, I'm good, and how are you? She's always more concerned about me than me being there to be her medical professional. The main shows that she watches before she goes to bed is Jeopardy and Wheel of Fortune. And that is keeping her mind active. And that's what we tell everybody that in the home. You need to keep your mind active. We had a birthday party for her this year at 108. She was so excited that all these people were there for her. She didn't quite understand, it's only me. I'm 108. What's the big deal? And it's an honor and a privilege for her to let me come into her home to make sure that she's okay and that she has everything that she needs. She's always told me to make sure you live every day because you may not be here tomorrow. And make sure you tell everybody that you love them because they may not be here tomorrow. I'm blessed. I'm blessed to be able to share the lives with these people. And they make me a part of their family. And that's the best part about my job.
I think that having the ability to go into somebody's home is just so different from seeing somebody in the office setting. You're really being there face-to-face at the kitchen table or on the sofa in the living room, and they see you differently. I think that there's a certain comfort level and a certain trust that comes from that, and it enables nurse practitioners like Kathy to take better care of their patients. Kathy is an excellent nurse practitioner, and she gives 100% every day to her patients. When the patient invited her to her 108th birthday party, I think that was the highest compliment she could have paid to Kathy. One of the strengths of Kathy being a nurse practitioner with visiting physician services is that she gets to visit her patients frequently and really form a strong bond, a relationship with them, so they trust her, they feel comfortable asking her questions, and they over time come to rely on her and see her as a part of the family. I wouldn't be surprised if Kathy played a small role in this patient's longevity. It really does mean a lot for these patients to have nurses come into their homes and really being there to advocate for the patients. Sometimes patients and their caregivers' families are hesitant to call the doctors and ask questions, and the nurses will not hesitate to pick up the phone and really ask those questions, get that information, and advocate for their patients.